Here's the tumor.
The odd thing is that they call me doctor. You want me to pull the wire right now?
No, don't touch a thing.
I don't even know what I'm doing.
Johns Hopkins is one of America's greatest hospitals. These are the stories of the men and women who work there.
I think there's a lot of attending gossip about us.
Personally, I'm going through a difficult time. You gotta get your emotions under control.
You were acting like a boob.
Without a transplant, he will die.
You have a heart.
No way.
We have multiple gunshot wounds.
It's a war zone here.
I don't want to die.
Okay, we have roughly a 40 to 50-year-old male. He is not conscious and not alert. Witnesses say he is a drug user. I'll see you in approximately 3 more minutes.
Hopkins clear. Medical critical care ETA, 3 minutes. I need a meal dough packet, please.
Charlie, wake up.
I grew up in Baltimore. I work in the emergency room where we see inner city Baltimore every single day.
Hello. This is just an
Pupils are pinpoint, minimally responsive.
Let's get some masks.
Is he breathing?
Breathing, but very shallow.
Charlie! Charlie, open your eyes! Charlie, wiggle your toes! His eyes are, one eye's open, one eye's closed.
So he's not responding to verbal commands.
248 over 142.
At this point, we made the decision to intubate this gentleman. He needs a CAT scan urgently. We're concerned about a bleed in his brain.
Could you not move him while I'm intubated?
1, 2, 3. Appears to be some kind of narcotic.
Oh, really?
That's normally what crack comes in, and that's what the heroin comes in.
Oh, okay.
Yeah, he's got a huge brainstem bleed. Ouch, that's not good. Yeah, he's got neuro's coming down right now, so.
We admit someone to the hospital, we take care of them acutely. I think a lot of times we are putting a Band-Aid on the problem. My 1 minute of time, I think, does not have much effect.
What does it feel like? Does it feel like a stabbing pain, or does it feel like pressure? Does it feel like a sharp pain?
Sharp pain.
Okay. Try to continue pushing the button, and if you continue to have pain, have your nurse call me back, and I'll come back. Okay?
Thank
All
you
right,
very
dear.
much.
No problem.
Okay, bye-bye.
Clear liquid diet is fine because he can't eat regular diet. And we can drop down his IV fluids to 63 cc's an hour. So I just had a meeting with my program director yesterday, and she, I guess she says I've lost some weight. I went to the gym last night and I weighed myself. Since I started residency, I lost 30 pounds.
Couple minutes, he sits bolt upright on the bed and screams out that he can't swallow. They suspect that he was using a cut torch and a gas tank.
ER paper.
Medical problems?
He is allergic to Keflex and erythromycin.
We start taking a look at this patient. Meanwhile, right next door to us, there's an 11-year-old kid coming in who had a cardiac arrest. He was playing soccer.
What's going on next year?
Pediatric arrest. So there's these big EMS guys doing chest compressions on a little tiny 11-year-old body. And, you know, you're trying to assess your patient, and then you have a little kid on the other side dying. Are you respiratory?
I'm actually.
So you keep hearing these things. We're losing them, we're losing them. Everything in the back of my mind is going, why is it taking so long for the kid to come back? Did you see the 11-year-old kid that they were coding right next to that guy?
No, what was that for?
There was an 11-year-old kid that was playing soccer. Apparently he had a cardiac arrest. Must have been, what, 30 minutes we were down there with the burn patient, and they were still going at it. Those codes on the little kids go on forever, huh?
Yeah, it's hard to say when on that, you know.
Dude. My head hurts from just being down there. In the back of your mind, you have this 11-year-old kid who was out playing soccer, who's dying, who's probably going to die. His parents are crying. Everybody's jumping on him. I don't even know what I'm doing. This is when it stops being fun. It's all fun and games. And then when you see somebody like a little kid dying, it just, you don't want to do it anymore. I just want to go home. Just want to go to sleep.
No vegetable?
Well,
Don't
I'll
like
try.
vegetable?
I'll try anything once.
Just haven't seen you in a while. So you seen anybody?
No.
I know nice people.
Well, I'll let you set me up. I'll trust you.
You have to tell me what you want at some point, though.
Like, professional? Who's nice?
Nice.
I don't want a guy. I've had only guys in my life.
Yeah?
Yeah. Well, my ex in med school, he was doing internal medicine. He was miserable. He was just not compatible with me. I'm way too domineering for him. You can't have two bulls in a pasture, you know. Is he serious? I'm a woman, and he's gonna get an intern sewing him up on plastics. Dude, come on. I think he got hit by a racket playing racquetball. He's basically an internal medicine attending, and he was actually one of my teaching attendings when I was an intern. You know, I want to get married. I want to have a family. I'd love to meet someone. I think I'm going on dates when it seems like the right thing to do.
So he's requesting Dermabond or maybe plastics because he's not married yet.
All right. Dr. Feldman, if you call plastics, it's going to be an intern sewing you up.
Glue, Ann.
If you're not married, seriously, you need stitches.
The glue's gonna be so much prettier, you don't think?
No. Come on, let me just look at it. Actually, that's not bad at all.
Nah.
5 little teeny stitches, and you'll have barely a scar.
You don't think gluing is better?
If you really want it to look good, I think you should let me stitch it. I'm telling you.
You could use Dermabond.
Yeah, but
it actually
his
looks.
Forehead. You know, if he cares about his face, I think that I'd rather have stitches. He's not married. I told him he needs stitches.
I can't say I've ever seen Ann's stitching technique. I'm sure Ann has done a lot of stitching, so I will hope that it goes very, very well for my forehead's sake.
Hey! Who's the patient?
Somebody.
I'm always afraid when I'm doing brain surgery, any mistakes that you make in the human brain are not little mistakes. If something goes wrong, it's very wrong. Professor Baumgarten, who studies heart disease, has a very complex lesion on the left side of his brain. This lesion is affecting his speech. The best chance to be able to get this lesion out is to be able to do it with the patient wide awake. So you're going to be awake, you're going to know what's going on. I put you to sleep a little bit when I'm doing the drill work because it's noisy, nothing else. There are no pains in the brain. I want you to know that.
At least I'm doing the sort of work where, although I don't understand all the subtleties, I understand enough so that it's a little easier.
I know. Why is this lesion so dangerous? Because as you can actually see right here, this part of the brain is very important for understanding a speech. That's the reason why we're doing this surgery today, wide awake.
Okay.
Bye, honey.
What? Yes.
Love you. I know. The whole thing has been surreal. It's a nightmare.
Yeah. Anna, let's do it, boss. Brain cancer is devastating. I look at the faces of their loved ones. At that moment, I have to believe that no one can do the job better than I can do it. Find out what we're dealing with, and imagine we just take a little bit of extra brain or something that we shouldn't be taking, and the patient wakes up absolutely unable to speak. And that can be a catastrophe.
Start. Trousers.
I'm going to be testing his ability to read words.
Journal.
To make sure that I preserve his ability to speak. You're doing a great job, Clyde. Keep going. I'm not quite sure if this is an infection or is necrotic tissue, but best scenario, this is an infection, and it'll be wonderful. I need someone to run this to stat gram stain, and I mean stat. I don't mean 2 hours from now. It was very suspicious for a very large infection, and that would be such a wonderful news for this patient instead of a tumor, because we can obviously treat an infection, but I cannot sing victory yet because sometimes necrotic tissue from tumor looks like that. Professor, how does it look? You're doing a great job, Clyde. Keep going. Right now, we just took part of that lesion and we send it to pathology. And this can mean the world of a difference for the patient. Imagine knowing that you have an infection that can be treated versus having a brain tumor that can be absolutely malignant.
Certainly consistent with an abscess or early cerebritis.
Thank you. Thank you, guys. Kelly, thank you. Clive, you here?
Yep, I did.
So I think that this is going to be an infection.
Right.
Which is going to be wonderful in the sense that this is something that we can treat.
That's great.
Great
That's
job.
fabulous.
I'm going to go and talk to your family. We just hit the lottery right here. I mean, it's just unbelievable. You know, and every now and then I've seen this in my career probably a couple of times, to be honest with you. And this is wonderful because everything else seemed to point out that this could have been a very malignant brain tumor.
Oh, that's fantastic. Thank you.
No, thank you. So, thank you, okay?
Oh, thank you.
Oh, this is a wonderful day, I think. Okay?
That's great. Great. Thank you.
Good. Thank you. Life is good sometimes. Life is good sometimes.
So do I get to scream when you do this? No, okay.
Okay. So,
I have to pretend I'm tough.
Yeah. Okay, you ready?
Okay.
So big pinch and burn. Oh, you've got an audience, but you can't look.
I can't breathe.
It's almost over. Just hold on. 2 more seconds. I'm just exploring it now.
You ain't able to see any good skull brains?
No. You're gonna have to explain this tomorrow at work.
Rounds will be interesting tomorrow.
You're gonna have to make up a really good story about this.
Well, and I'll tell you how I got this.
Which was how?
It was an immaculate.
It was an immaculate process.
Yes.
Suddenly you started bleeding from your
It
head.
just appeared.
So you've got 5 interrupteds and a bunch of gooey bacitracin
And a good story.
and a good story.
Oh, it's sweet. I think that's gonna heal nicely.
Medical patient, 2 minutes, mail dough packet. Medical patient, 2 minutes, mail dough.
Wish for 500 bags.
Okay, so we have asystole on arrival, but there was some narrow complex. What has he gotten so far? Can you drop another round of epi and atropine?
Epi's in.
Perfect. How long have you guys been coding him?
We just try to run a little bit of fluid, give him 1 round of jugs. I don't think there's much else we can do.
There's no pulse manually.
Yeah, he's getting colder too.
Is the pressure bag flowing?
22 minus 5.
Anybody think of anything else to do?
Anyone have any objections?
21, 23, time of death.
Do we know he has family here?
Yeah, somebody's outside, I heard social work say.
So I'm gonna go talk to the family right now and let them know what happened. People that I've grown up with or friends just cannot even fathom what the daily life is like in the emergency room. Hi, how are you?
Okay.
Nice to meet you. The paramedics brought him in, and his heart wasn't beating at that time. And we did everything we could, but unfortunately, he passed away. So I'm really sorry to have to tell you that.
It's like I was prepared for that.
Were you? Yeah. It seemed
God
like.
prepared me for this.
Yeah, it seemed like you kind of thought, you kind of knew. You touch a lot of patients each day, and you just have to find a way to relate to everyone, otherwise you won't be effective.
Hey. Here's your gift, Doc.
Wow, look at that. Where'd you learn to do that?
I forgot to put your name on here.
Oh, okay.
You should make them with dollar bills.
Oh, that's really nice of you. Thank you. Appreciate it. I'll put this on my desk. Thank you.
There you go.
Take care, okay?
Oh, you
Take
too.
it off now.
Thank you.
See ya. She said she really would have liked to date me back in the day.
Really tough or the 83-year-old?
The 83-year-old, and she pulled out a picture of herself, and she was like a really good-looking woman in 1940. It was like tight little bun. Like she was really cute.
No, honey, this is not the way that you meet women.
Hello? Everything went very well. We should be there between 7:15 and 7:30. I never really envisioned a career at Hopkins. This was just like, almost unachievable for, a medical student from Rome. Hopkins is sort of like the Yankees. Everyone in Europe knows the Yankees are the team from New York, and if you played for them, it puts you at a different level.
Samantha is a lovely 7-year-old child. She has been adopted from China.
It's okay. I just adopted her when she was 6. They sent me her pictures. That was it. I saw her picture and I said, yes, that's my little girl.
Samantha has multiple holes in her heart. We know that she's had surgery in China, but there's something going on with whatever repair she had that is not working. So she gets tired with exercise and she gets blue. And on top of that, inside the heart, there are leaks. As I'm looking at her like right now, I would never guess that she has complex congenital heart disease.
She gets tired so easily. Yeah. Her lips get blue sometimes.
Her previous surgeries were all done in China? All of them?
When she was about 2 or 3.
No, what I want to do is just very briefly, I just want to take a peek at her.
Okay.
Just the incision
No.
here.
Okay.
No?
It's okay.
It's all right. Our puzzle is that we really don't know what they did in China. Now we have to sort of get in there, find out what they did, and then fix it. There you go. That's it. That's it.
That's
Not too much
that
more.
was easy.
It's about the quickest exam I ever done, but you know.
What's Sam's level of understanding, do you think?
She just knows her heart needs to be fixed.
Does she sleep with me? She can sleep right next to you, yeah? Good.
She's only been with me a little over a year, but I couldn't imagine her not being around. I think she senses that I'm scared. I'm terrified.
To see previous episodes of Hopkins, go to hopkins.abcnews.com.
Just got paged by the emergency department for a hand consult. Basically, a 29-year-old Spanish-speaking only gentleman. From what I understand, he sliced off his left thumb. Eso sucedió en la mañana. Estaba trabajando con maquinaria.
Sí, una compañía. Estoy en una barrota.
My parents, both, when my mom was pregnant, were living in northern Mexico.
¿Ha aprendido bastante español? No.
Yo soy mexicano. And that's pretty much where I grew up until the age of 12. And then we immigrated to Globe, Arizona. ¿Tiene dolor?
Sí.
Clearly, I think it's just the tip of the thumb that was injured. I told him, and I was honest, I don't know what to do, so I need to go talk to my chief resident in the OR, so we'll go back and see him right now. I have a 29-year-old guy who was working this morning, and he basically chopped off 1.5 centimeters of his thumb. They tried to find it, but they couldn't find it. Question is, do I leave that open, the thumb open, or do I close that too?
So irrigation and closure. With, what do you want to use?
3.0, 4.0 Vicro.
4.0? No, I wouldn't use Vicro.
I just want to run over my ideas because, again, we're talking about a guy who just came out of med school 7 months ago. The odd thing is that they call me doctor.
No hay dinero en nuestro país.
Without him working, he has no money. His whole family has no money. No siente dolor? He works with them, all Hispanics. And then he made the comment, we're the ones that are getting this country forward.
What's those things?
Oh, that's a heart. So in you, it would sit just like that, look, just like that.
She had heart surgery when she was younger in China, and I was told that her heart disease was repaired and she was fine. So I didn't know she was going to have to be going through all this again.
Right over here, there's a little hole, and we're going to go right in there and just make it close. Get it all better.
How about we glue it?
That's it. That's what we're going to do.
We'll glue it.
This field, in spite of giving you this amazing sense of power, is the most humbling discipline in surgery. Because when things go wrong, it's a disaster because you're dealing with a child.
Can you do it? Use both spoons.
It's so heavy.
She's the best thing that's ever happened to me. The best thing. Come on. Would?
Would you like...
She's had so many caretakers, and I just try and let her know that I'll be there for her forever.
He used to carry me way up high on his shoulders.
Okay.
In the sky.
In a field like cardiac surgery, there's very little time for families. There's always a call, always a page. But you'll learn to live with it. Okay, ladies and gentlemen, Tony Vercella. Whoa! Oh, how to lose your dog and child at the same time. Vieni qua tu. Dove vai? You have to wear your helmet, Tony, okay?
It's hard for me to be strict, you know, when I come home, it's, you know, I haven't seen him for a couple of days. I mean, tonight is like a rarity. And so it's hard to say no all the time, if that's the only time that you're there.
Prima finisci quelle che c'hai e poi prendi quelle altre.
My family, of course, has been very supportive throughout this whole journey. You know, for them being really uprooted from Italy was a big, big undertaking. I feel very fortunate to have healthy children. When you see a child that's approximately the age of your own, that plays in the emotion that surrounds a case.
Okay.
And that's why a lot of people don't go into pediatric cardiac surgery, because the stakes are different. You know, this could be your kid.
So now I'm gonna put splints on this gentleman. So you jumped out the window to try and get back to the bar.
I was celebrating my birthday, and I was trying to get to the bar, back to the bar. She said I had enough to drink. And she locked the door because I went out the window.
The next time you should lock the window, huh?
Yeah, if I had known, I didn't think he was gonna go out there.
Yeah.
I knew he went back up the steps, but I'm like, he ain't going out the window.
How high was it?
Like 20 feet up.
All right, we gotta bend this a little bit, okay?
Yeah.
Keep it up. Either has a small calcaneal fracture, which is like a heel bone fracture, or a small bone spur. So we're just gonna put it in a splint. Just give him crutches and have him follow up with the orthopedic doctors. But he's lucky that nothing else happened.
He's hard-headed. He's just hard-headed, I told him.
I learned not to jump out no more windows, I tell you that.
I've studied all this time to be able to say to parents, this is not the child that we want to let go. This is a child we want to hold on to. This is the child that we can do something for. The risk in not operating is that she will be kind of a crippled child.
What are they gonna do?
Fix my heart.
Yeah, here we go.
Here we go. That's right.
This is definitely not the straightforward case. We have to stop the heart for this operation probably for a good 45 minutes to an hour.
I love you, princess. I'll see you in a little while.
I'm gonna take care of her.
All right, thank you.
Is anybody out there waiting with you today?
No, my parents are on their way now.
I can't comprehend what Lisa must be going through. I mean, this little girl's her whole life. She was lonely, and she's always wanted a child. And when she heard that it was possible for a single girl to adopt in China, she just put her heart and soul in it.
She made up her mind that she wanted to help a child and get a child and bring it. She did it, whatever it took.
Decision at 9:45.
The dilemma is what to do once we're in there. The best thing to do is just to go to the operating room and just figure it out on the table. We're digging everything out. Pretty stuck. She has so much scar tissue from her previous surgery that it's just not easy to get to her heart. So we've got to be very, very careful here, because if we put a hole in the heart...
We're still looking for this vein on the left side, this sort of abnormally placed vein that drains the upper body.
Once you cool down to 24.
So she's got a number of things wrong. The biggest trick, though, is that they've repaired things in there already, so we need to go back and sort of recreate the normal transit of blood through her heart.
The options this morning were to either patch the holes or to just create a complete new arrangement of the circulation. So we chose to actually close the holes rather than creating a new circuit.
I'm just worried. I just want to see her. I just want to see her.
Clamp is off. Back up. Open to the patient. 10 minutes.
Something's wrong here. So, what's your last hemoglobin, guys? 13. Are you sure the lines are going in?
Yeah, 0.2. The lines are all up there, and the Epi's at 0.2.
Ken, you're sure that your lines are going there?
The lines are all up. Carrier's on. The lines are up.
Pressure's falling dramatically. Something's wrong here.
Hopkins continues.
Okay, guys, something wrong here. Pressure's falling. This is not right.
She doesn't have that much swelling, so it's not entirely clear why she's having this problem.
We have to go back in there. She doesn't like to be closed.
Today seems endless. Like, when is it going to be over?
Now, let's see what happens here, guys.
Function looks good. The saturations are okay. Anyone had something to say? Say it now.
Forever hold your peace.
This is decent. The number in parentheses is the mean arterial pressure. Having that number up above 55 is great.
All right. This was extraordinarily painful. We saw the holes clearly.
Okay.
Closed them all off. So at the end of the case, there was something that she did that kind of got us concerned. We had the chest closed, the skin closed. And then her pressure just dipped down substantially. Now we're doing okay. Next few hours are going to be the most critical hours.
I think that as long as we can get an OR for tomorrow morning, we're going to start her getting better faster.
So make sure that she's on the list and everything for tomorrow then.
The exciting thing about organ transplantation is that we meet patients that they're terribly sick, they're going to die, but there's only one thing wrong with them. And if we can find them a donor, they're completely restored to their healthy lives.
Give me a hug, I understand.
We're hopeful and optimistic that we may have a liver available for Joel Bray. Mr. Bray has been waiting for a few months for a liver transplant. He's really been waiting his whole life.
I'm just hoping I can get it, you know what I mean? And I'm not ready to die, you know, by no means.
If you pull straight up, you got the shot every time.
When Joel and I dated, you know, he had been in and out of the hospital, and that would happen periodically. You just kind of thought this was just the way of life, and he'd go in and they'd fix whatever was wrong, and he would come home. Not until, like, the year 2000 did it really hit home that this is life-threatening.
That was a good shot, Matt.
So we have a liver available for Joel, and my partner Warren Maley is going out to look at it. And if it looks great, we'll use it for Joel in the hopes of saving his life before it's too late.
We shall find out in about 10 minutes whether it was worth the trip.
This liver might not be satisfactory in that the donor is someone who is quite obese.
Her weight's 347.6.
She is quite large as build.
It's a dangerous game to wait. It's the right thing to do to go out and visualize every single organ offer you get in the hopes that you'll see one that others have overlooked.
There is almost nothing in here. Peanut butter and crackers. Let's go. Yeah, I was a really weak medical student. Basically, I had failed everything. So all of a sudden, at the end of the year, I'm down to my surgical rotation. That very first day, I knew that I was going to want to go into surgery. Maybe we don't have to take all the toes. You know, you're going to end up taking 2. You do an amputation, go right down to the bone. I always thought that I was a pretty good teacher, and so that I thought I had something to offer. You choke up on the knife, hold it like you mean it, okay? So you're just really interested in vascular surgeries while you're coming in on your Saturday off?
Absolutely, sir, and operating with you.
Yeah. Ooh. Did you see that money move? Mimic it.
You're pretty good at this.
I've done a few. Sometimes during cases, they're just monotony. And I think you actually stay sharper if you have something going on.
Look at the size of this thing.
I know, she's getting you another needle driver. Remember, you go to the OR with the equipment you have, not necessarily the equipment you want. Donald Rumsfeld, 2003. You don't have to be serious all the time. This job can be fun. Oh my, who operated on you? Cutting you all up. It's actually sort of fun when you have someone who comes in and they're angry about being sick. They're just feeling cheated in life. Okay.
So you're not going to do nothing to it?
What do you mean? What more do you want me to do to it?
I don't want it rubbing on nothing.
Okay. You're the boss. She had years of problems. And when I walked in and met her, I said, boy, I need to take off part of your foot, and I need to give you an AV fistula. And she looked at me, she said, get out of the room. That's about all she said to me.
What do you think of this doctor?
I think he's wonderful. But
holy mackerel. You never said that before. All you've ever done is at me. It took about 3 or 4 months before she first cracked a smile. And man, that day she started laughing, I was like, yeah, finally got her.
process of getting Joel down to the operating room and taking his liver out until we know that this organ is usable.
Let's have culture swabs.
Any culture swabs, please?
Charnel, it's Andrew. How you doing? Have you heard news yet?
You see how this liver is sort of cobblestone? The liver ought to be as smooth as the stomach is right here. Can we get Dr. Cameron on the phone?
Hey, Warren. How are you?
This is a liver that shouldn't be transplanted.
So I'm going to go talk to Joel right now and tell him that we're no-go.
We'll keep looking hard, and today it's just not the right thing to do for him.
All right, sorry about that. Talk to you later. I got some bad news and some good news. The bad news is this liver's no good. You don't want this liver. It's not good enough for you. And we're still going to hustle to get you a good liver, you know, as soon as possible. When we get him a good liver, he's going to fly. He's going to live a long, happy life, and all these problems are going to be ancient history. We get him transplanted, you can just change everything from you're definitely going to die to you're definitely going to live. And, you know, you go out and you tell the families, it went great. He's going to live. And you know, you have some incredible exchanges with those people.
I want to hold a book or a journal in my hands and read it.
In the first year of medical school, I sort of realized who my dad was. On the one hand, he's just a doctor at Hopkins. And on the other hand, he was the chief of surgery for about 20 years. That is a very interesting portrait of Dr. Blaylock.
That portrait hung down in the lobby of the Blaylock building.
Okay.
And someone came by the first month I was chairman and took a pencil and poked his two eyes out.
Isn't that terrible?
So I had my portrait have glass over it.
He was a force in American medical education. You know, a little kid grows up wanting to play baseball, you know, for the Orioles, want to get into the big leagues. And then just when he's making his way through the minor league system, he realizes his dad is Cal Ripken. And you know, that's me.
What's going on this weekend?
This weekend, I am very hopeful to get this guy, Joel Bray, transplanted, who I don't think you know. Hello. So another donor liver's become available for Joel, and I'm very hopeful that this time it's going to be a good one for him.
I was scared the first time. This time here, I'm just more nervous than anything, just because of the major operation.
The liver looks good. It's not terribly fatty. The arteries, it looks to be normal.
Well, that's great news. Thanks, Warren. Okay.
Bob Montgomery is on call today, so he'll be the one to do Joel's surgery.
Hey.
Hello.
So we got good news from Dr. Maley. The liver looks good.
I guess this is it. I hope he's not a new man. So at least play basketball, get with the boys.
Kids, love you. I love you. I mean, we are a family, we are married, we have children, and this is what comes with it, in sickness and in health, and for better or worse.
This is very complicated surgery. It's the most complex operation that we know how to do.
He is going to be a challenge, no question. So we're up for it.
I get a ticket for a free hot dog, but I have to pay for parking. I've only been here a year and a half, and I'm not part of the old school. Do I still get a free hot dog?
Baby boy, you late.
Am I too late? Even if I have a ticket?
You want to see if they got any hot dogs back there?
Excellent.
If you would have came on time.
Well, you know, some of us...
This, and a can of soda, and a cup holder.
So instead, it's going to cost me, what, $10.50?
I'm just gonna charge you for the drink. Because I can't give you that drink, but I'm gonna help you with this.
Excellent.
Come on time. Be on time.
My middle name is on time. My personality gets me in trouble sometimes, and it keeps me out of trouble sometimes. You know what allergies are? What? Maxheimer?
What are they?
And let me preface this by saying that I have no allergies. Okay? Go ahead and snip. Allergies are undealt with childhood issues. Okay? So, if you have a bunch of allergies, you don't treat it with allergy medication, you treat it with psychiatry. You know, something in your past is just hanging on. I forget where I first heard that. It was a long time ago, though.
It's funny because I've never had allergies until I came out here to the East Coast.
Oh, so you think it's our water?
I think it's something out here.
Maybe it's the nurses. The nurses are different.
Alrighty, I'm gonna give you some oxygen now. You can just take a couple of deep breaths.
Joel has had health issues ever since he was little. Ultimately, the only thing that was going to fix what was wrong was a transplant. So it's nice to be here.
Patients like Joel Bray want that second chance. When transplant works out, we have the opportunity to give them back all the things that they thought they were never going to get to do again.
We haven't even really gotten to a point where we can see the whole liver yet. There are a lot of those abnormal blood vessels that want to bleed. So clearly the tough part of this operation is going to be getting the old liver out.
One, if you want to grab a wheelchair. All right, I see you up there.
The new liver needs to go in as soon as possible. The more time it spends in the cold, the greater the chance it is that it won't perform well.
Oh, there's liver. Looks good. A lot better than what he has.
This morning, I was a lot more anxious. Now I'm just kind of excited for it to end and be over and see what lies ahead.
All right, liver's coming out. It's a very abnormal liver. It's very rubbery and firm, which means it's filled with scar tissue.
I'm ready for it to be over and say it's in there and it's working and we're good to go.
So this liver that's all pale and white is about to turn red as the life blood comes back into it.
Hello.
I was just calling to let you know that everything's going well and the liver looks good.
Okay.
You see how the liver's starting to turn a nice pink color? Starting to see a little bit of bile coming out. But I'm real happy with the way the liver looks. Nice work. Thank you, everybody. Well, we have good news. He's going to feel like a new man. So the first 24 hours are kind of critical. Occasionally, one of the blood vessels going into the liver will clot, and that's a significant problem if that were to happen. But we're off to a great start.
Stuff up here to get ready to roll. So it's been about a week and a half since the operation, and I'm getting ready to leave the hospital today. I just can't wait to get home, you know what I mean?
I've been married to Joel 20 years, so the fact that this could be behind us is pretty awesome.
Thanks a lot.
Thank you.
Thank you, yep.
Thank you.
We're going to keep a close eye on Joel. He's not entirely out of the woods yet. As sick as he was, as big an operation as it is, things can always go wrong, but we're really happy with how he's doing.
This is a new beginning. I hope everything goes well.
Look at her. She's doing fantastic. She's really made an amazing recovery. You'd never know she had any problems. Samantha wants to try everything. She just signed up for soccer, which is starting in about a month.
I do like soccer and swimming. That's like a sport.
She's just changed my life, and Dr. Facella has changed it too. Dr. Facella is just my hero. He's given her a new life. Thank you, sweet pea. I can never thank him enough for what he's done for her.
When things don't go well for a patient, it's of no consolation to them that the other 10 went well. We keep going and hope for a better outcome with another family. I've seen many times the transformation from just how sick they are to just how perfect they are after transplant. You can take people that have hours or days to live and give them back their lives. And, you know, they're planning vacations. And that is, you know, that's why we do it.
Forever with me. Forever with me. Forever with me.